Good afternoon, everyone, and welcome to the Chamber of Commerce webinar series. We're going to start in about 30 seconds. So grab a glass of water and we're going to get rolling with Dr. George Rutherford. Good afternoon, everybody. I'm Rodney Fong, President and CEO of the San Francisco Chamber of Commerce, and want to welcome you today to a very special treat. We have Dr. George Rutherford here from UCSF Hospital. He is a leading authority in the nation and the world on this subject, and want to hear from him. The Chamber of Commerce, as you know, we find ourselves in a very different world, different spot right now. San Francisco is just the center of so much activity, and with shelter in place, I think we all owe ourselves a little pat on the back for doing a good job and staying indoors. Obviously, some of those outside could spend a little more inside, a little more time inside, and the doctor might give us some good advice on that. Dr. George Rutherford, an incredibly impressive resume, a number of titles I can't even begin to pronounce or tell you. Hopefully, he'll be able to do some of that. But he is the leading expert on and the virus expert at UCSF. Dr. Rutherford has been in public health service since 1995, has interests largely focused in control of infectious diseases and public health importance, and especially with HIV infection and emerging diseases in low and middle income countries. So this is very important. I guess one of the reasons why we are so lucky to live here in the Bay Area, live in San Francisco. And for those of you who don't know, the impact that UCSF has on San Francisco. So UCSF, Zuckerberg Hospital, General Hospital, is a city hospital. All of the employees there are UCSF employees. Contact tracing is largely involved with UCSF. The testing lab here in San Francisco, almost all the testing is done at UCSF, and the Mission District testing is also happening through the great help of UCSF. So they've been great partners for many, many years, great partners of the Chamber of Commerce as a member, and just so vital to us as San Franciscans. I want to turn it over to Dr. Rutherford. Obviously, you've been giving a lot of talks, a lot of information. Things are changing daily, hourly. For this community, obviously, our own personal health and our loved ones is so important. But also, coming out of this, as we begin to maybe just think about, not take action, but think about phase 2, phase 3 in recovery, what that can mean, what is, in your opinion, what does it look like for the business community to prepare itself for a potential reopening someday,
Sure,
when we're ready?
Well, thank you very much, Rodney. It's a real pleasure to be here. It's nice to meet everyone virtually. I'm flattered by your introduction. Someday I'll teach you all the ins and outs of UCSF nomenclature and organizational stuff, but we all kind of pull together as a big team. The other thing is that UCSF and the San Francisco Department of Public Health have a very, very tight relationship to one of these almost completely overlapping Venn diagrams. So we've been well positioned to move in to assist the city in any way that we can, and including contact tracing. So I'm going to start off by sharing my screen and giving you a little update on COVID-19 worldwide. So we might as well start with the world. Wait a second, maybe. Hold on. We might as well start with this world. This is a so-called epidemic curve. These are histograms with each by date, going back to December 30th, when the first cases were reported to the Chinese Centers for Disease Control. Here on the left-hand side, these orange bars, you can see this is the epidemic in China, which has waned. Then it was replaced by a large epidemic in Europe, which was actually much larger than that in the United States for quite a while. But as of late March, early April, cases in the United States really surpassed those, eclipsed those of Europe. And right now the United States has 1/3 of all COVID-19 cases in the world. couple of things to see here. The purple here is mostly Iran. The infection spread from China to Iran to Europe, and then to the eastern United States. The western United States was largely seeded by returning travelers from Asia, predominantly China. This is the Johns Hopkins map where you can get a sense of where this infection is currently. Again, the U.S. has about a third of all the cases worldwide, but we don't have a third of the deaths, luckily. We have quite a few deaths, but just to give you an idea, Italy still has the greatest number of deaths in the world, followed very closely by the United Kingdom and Spain and France. Okay. Now, one other thing to note is here's the equator right here. Here's Ecuador. That's always a good marker for where the equator is. And you can see their cases below the equator. So, this whole idea that's going to magically go away in the summertime, didn't happen in the southern hemisphere during their summertime. And there's a lot of basic science literature around this. There may be some small benefit from warmer, more humid weather, but not a lot. And by the way, the last time I noticed it didn't get particularly warm in San Francisco in the summertime. This is a slide from the World Health Organization where the darker means more cases in the last 7 days, with more than 100,000 cases reported from the United States. But also you can see there are a lot of cases that are coming up even in Brazil, Peru, India, Russia, Turkey. Turkey's always had a lot of cases. Italy and Spain have been particularly hard hit, and Great Britain. So this gives you an idea of where there are active cases right now. There's a large outbreak in Mexico, right up on the border in Tijuana, with that kind of, sort of desperation level ICU care that we've seen in New York and as well as in Europe. Here in California, Alta, California, we've had 53,616 cases reported, and 2,215 deaths from COVID. Right now, there are 3,318 patients hospitalized, of whom 1,169 are in intensive care units statewide. We'll talk a little bit more about this for San Francisco numbers. I'm going to drill down on Bay Area numbers. But up here, check it out. Something like 28,000 out of the 53,000, almost half of people were under the age of 50. So when your kids tell you they can't get it, they are wrong. Tell them to talk to me. Just don't email me, okay? And this is looking at the 9-county Bay Area. This gives you this is a kind of a 7-day average. And you can see this gradual decline that we've entered into. This is true really across all of these counties, with the possible exception of Alameda that's had a little tick up, and Contra Costa that's had a little tick up. No, it's Solano, which has had a big tick up. But overall, you can see the numbers of deaths here in the 9-county Bay Area. The last time I added these up, there are 272 deaths. San Francisco, we've been somewhat more fortunate. We've had 1,624 cases and 29 deaths. The cases are people with diagnosed disease. They're people who are recognized as possibly having COVID, who are tested, and who have a positive test. The stuff you hear about people who are asymptomatic or mildly symptomatic, who represent probably a good half, if not 60% of all the cases, are not diagnosed, and they're not included in these numbers. But these are the same way that everyone else is counting, so we're counting them this way as well. And just so you know where this is geographically, it's south of Market, especially over here on the more eastern side of south of Market. It's in the Mission, and it's in the southeast. You can see this sort of darker blue here, which is where there are predominance of cases per residence. Not much in the avenues at all. Now, Mr. Fong asked me to say a few words about social distancing and do we know that it works or not? Well, there wasn't a lot of experience with social distancing since the 1918-1919 influenza pandemic that I'll speak to in 2 seconds. But there is some empirical evidence that social distancing works. Italy's had a horrendous outbreak of this with, most deaths in the world. The intensive care units absolutely flooded. All the Annie Leibovitz photos of healthcare workers looking like they're about to drop are really from Italy more than anywhere else. So there are 2 adjacent or semi-adjacent Italian provinces in the Lombardy region. Lombardy is where Milano is. So one, Lodi, not Lodi, was where the outbreak in Italy began. They went to a very early on to a shelter-in-place program, not quite similar, not dissimilar to San Francisco's, and they went to shelter-in-place on February 26th. Another area, which is sort of like one county over, essentially, called Bergamo, they began shelter-in-place program 12 days later. Remember that February had 29 days this year. And you can see what happened here. So in Lodi, this is what the outbreak looked like. And in Bergamo, same scale, this is what the outbreak looked like. This is what shelter-in-place buys you. It gets you this and not this. This is the flattened curve everybody talks about. Okay. So for those of you who read Italian, I don't have to translate for you. Data from Lodi demonstrated the measures of lockdown, which is how you say lockdown in Italian, repel the contagion. Okay. Now, I was, of course, the beginning of baseball season, I couldn't help but rush out and do the same thing for San Francisco and Los Angeles. San Francisco went to shelter in place, as you recall, along with the other 5 Bay Area counties on midnight on March 16th, which was pure genius because it avoided the social mixing of St. Patrick's Day. Los Angeles went to shelter in place later. I'm sorry, this is the wrong scale, but it's in Los Angeles. They started on the 20th of March as part of a statewide order for sheltering in place. But it really wasn't truly kind of enforced, or people didn't really start to move to it until the following Monday. So we had almost a 6-day head start on the Bay Area versus the rest of the state. And you can see kind of what's happened since then in Los Angeles. I mean, it was sort of most dramatic. This is, I think, what we could really attribute to earlier sheltering in place. Then they started to level off. And then they had, first of all, they got a lot more testing. So they're starting to count people who are asymptomatic. But they also had some spectacular outbreaks in their homeless population that pushed these numbers way, 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 way up. Now, the governor talks about having to have shelter, see declining numbers. It's kind of hard to see when you look at it day to day, so I've amalgamated these by week, and this is the week that's just ended yesterday. And you can see since early April, there's been a gradual decline in the numbers of cases per week reported in San Francisco. And this is even in the face of expanded testing, which, if anything, should push these numbers up. So this is all quite favorable. We can look to the Bay Area counties, and the decline is still quite apparent, even though it's somewhat more modest. Now, one of the things we worry about is a so-called second wave. And this is a complicated slide, but let me walk you through a couple of points here. So over here in C is in Charlie. These are new cases per day among individuals who are 55 to 59 years old. And these in G here, as in golf, are from 10 to 14 years of age. And these are kind of different conditions, but the yellow one or the green, or however it's showing up on your screen, the farthest one to the right is kind of what we're seeing, probably the most analogous to what we're seeing in the Bay Area. We had an early increase, right? We went to a shelter-in-place program, right here. That's the intensive control measure. and we continued it through April. So we had this period, essentially had this it wasn't quite this much, but we had an intensive period of sheltering in place and intensive control. What you can see is that given that, these data would predict a second wave out here in the fall, in the later fall. And the thought is that a lot of that would be associated with transmission within schools, and then school children and middle school and high school students bringing the viral infection home to their parents, and even worse, to their grandparents. This is modeled. This is not real. Hasn't happened. But this is what this is what we're concerned about, and it gives you an idea of why when we talk about returning to normal, those of us in public health are rolling our eyes and scoffing, because there's no return to normal until we're beyond this period and we get people vaccinated. That's the bottom line. There's no in-between strategy. Now, just a cautionary tale. In 1918, the Spanish influenza swept through the United States military camps in the spring. There was a long lull in the summer, and then it reappeared again with a vengeance in the fall. This would go on to be probably the deadliest outbreak in the history of the world, with maybe as many as 50 to 100 million deaths worldwide at a time when the world's population was 1 billion. Okay, so that's truly decimated. It was the world's population was reduced by a tenth, or almost a tenth, by this. In the United States, there were as many as 20 million cases, at again at a time when the population of the country was around 100 million. So it was 20% of the population was infected, and there were approximately 675,000 deaths from it nationwide. So that's a big hit, right? So here we have a picture. So San Francisco was one of the cities that was predicted that would not do well in this epidemic. And that's because we were a port, there was a lot of commerce in and out, and there were a lot of travelers. The infection first came to San Francisco in September on a traveler from Chicago on the train. That person was quarantined. It was isolated in his hotel room. His contacts were quarantined, but the infection had already spread. And it spread through the city pretty quickly. The city health department and the Board of Health moved quickly to establish a bunch of controls. And it's sort of crazy to read them. They sound crazy to read it now, but things like banning Sunday schools and stuff like that. But they're basically mass gatherings, and push the whole agenda of sheltering at home, closing businesses, and have everyone wearing masks. The mask was a particularly controversial part of it. People didn't really like to do it. There are proponents on both sides of the mask story. But eventually the Board of Health, in the face of good numbers, relented. And on November 21st, 1918, 10 days after the armistice that ended World War I, the whistles blew citywide at noontime, and everyone threw away their masks, just like this family is doing here. There were all-night parties, all-night throw away your mask parties, and so the city had returned to normal. However, within a week, influenza was back, and by the time the epidemic was over, in February, 3,000 San Franciscans had died. So right now we're sitting at 28 deaths, and we have in our minds that the butcher's bill here could have been in the thousands, and we've kept it in the teens, in the 20s. So this is a cautionary tale, and I'll just show you kind of in numbers what happened. Here's San Francisco. Here's the green, which is the predicted mortality. San Francisco came in at a little less than half, maybe even as much as as little as a third of the excess mortality. But because of this stopping the public health measures here, throw away your masks, not redeploying it until it got really bad again, there were all these excess deaths that accumulated over here. St. Louis had a similar experience. They had flattened their curve remarkably well by starting very early with social distancing policies, but they had a smaller gap, but there was also a rebound and the disease came back and had to be suppressed. Whereas Philadelphia, which is always held out as being the kind of the worst case in North America, had some effect. They didn't really start instituting their social distancing until they were well up on this curve. Sorry, what have I done here? So they were well up on this curve, right? And they came down and they had a very small minor one out here. Now remember, this is for influenza A, in which there's true immunity and people who get it can't get it again. As we may just end up discussing, it's not at all clear what being antibody positive or having antibodies to COVID-19 means in terms of long-lasting immunity. So Philadelphia, this back end here in Philadelphia is really probably the result of naturally acquired immunity among the population, but it's the cautionary tale is over here on the left with this big rebound in San Francisco. So I'll stop there and happy to answer any questions. You're muted, Rodney.
Thank you. This is fascinating information, and some of us have seen some of the data for the city's good data tracking website, but you've laid out in a different fashion. I'm kind of curious, and a couple of questions came in. Any clue as to our Bay Area, San Francisco homeless population community,
Yeah.
and if they've been more affected than others? We saw the map by districts, and that clearly shows that people are. Many of those workers who live in those districts are servicing the city.
Right, or they're the homeless people themselves.
Right.
Yes, there have been a couple of outbreaks in homeless shelters. It goes through this population. It goes through any kind of congregated population, like a hot knife through butter. And the homeless have been particularly hard hit with infection. Now, having said that, they don't seem to get very sick from it, at least the ones we've come across, because we've been sheltering the elderly and the frail homeless already. So they were kind of out of the stream of, out of the line of fire. And it's sort of more the younger and slightly less disabled homeless people in the shelters who became infected. It may be as many, in some shelters, it was as many as half of people were infected. The other big population we worry about are people in nursing homes and long-term care facilities. And so there's been a tremendous amount of attention paid to Laguna Honda Hospital, as you may imagine, which is the other city hospital besides Zuckerberg San Francisco General. There was an outbreak there mostly among staff, with only 3 patients infected, all of whom did pretty well. But, you got, an old population, an elderly, frail population there. You basically have all the risk factors sort of rolled into one. So the city health department has been very cognizant of issues around long-term care facilities, nursing homes, skilled nursing facilities, places like that tend to congregate a lot of elderly people. And now that we have testing capacity, they're instituting a program of testing everyone every couple of weeks to make sure they find cases and get them isolated properly as quickly as possible. Mm-hmm. And it's not just the patients, it's the staff too.
Mm-hmm. Can we talk a little bit about what the new normal might look like? And you've talked about that, mentioned that things are going to be different. I think
as opposed to this, talking on the TV.
Yeah, right. And my specific question is, let's say we begin to relax a little bit, and other states are beginning to relax a little bit. What's going to be the mechanism to measure whether we should retreat back, or things are okay, let's stay with this program of this phase of relaxation? What's like an allowable amount of spread?
Sure. What we want to see is continued decline in the cases. We have several other things that we look at as well as that. We have all sorts of calculations we make, but basically, if you just look at the decline in cases, that's pretty good,
Yeah.
pretty close. We think there's very little virus circulating in the community now. We think it's mostly in sort of large households, large families, lots of people living together. And it's going sort of from one person to another person to another person to another person. And that's where the bulk of our cases seem to be coming from. We also have essential workers. We're out in public every day, everything from grocery clerks to the garbage men to the people repairing the streets.
Mm-hmm.
And they're also, they're out in the environment. They could become exposed. And there are a few other handful of reasons people are getting infected. But, what we're trying to follow is how much infection is ongoing, so-called incidence. We're undertaking a very large study with Stanford to directly measure incidence in all 6 Bay Area counties. We're hoping to start that this week down at Stanford. We're sort of splitting up 4,000 patients between the two of us with ZSFGH. So watch for that. You'll start seeing snippets about that. And that was meant to be a real kind of signal for provide the data inputs for the governor to say, oh yeah, we can start to move away from this, which he has said, right?
Mm-hmm.
You'll notice certainly it's like construction it started today. Outdoor work started today, outdoor vending, things like working in the nurseries, gardening, trimming trees, all that stuff started back up again today. And it's, we're getting going. But what we have to do is shelter in place works great. Okay. We've reduced the case counts. We've reduced all the parameters we look at. It's had a remarkable success, and it's been remarkably destructive to the economy. If you don't want to go back to shelter in place, you have to wear your masks. Okay, there's no fooling about this, and I think the police are going to start arresting people, or not arresting, or at least giving them tickets for not wearing masks. Because that's all. If you want to go back to shelter in place, don't wear your mask. Screw around. Go to the beach with all your friends and neighbors. Just don't do it, okay? Just wear your masks.
I'm so glad
Keep
you said that
social
because
distancing. It's not a big ask,
made like 30. My wife's made like 300 of them over here in the living room, and I'm glad you say that they're going to get good use. Yeah.
Yep. Should I give out your phone number as a place for people who need to buy masks?
I'll mail them. Yeah.
It is the Chamber of Commerce. I figured you know how to do this, right?
Yes. Yeah. Contact tracing.
So I mean that's what the new normal is going to look like. We're going to slowly reopen businesses. It's kind of the last straw, the last thing, the stage 4 that Governor Newsom talks about are crowd events, concerts, big sporting events. What else was there? Conventions. Those sorts of big things that a lot of the revenue in San Francisco stems from. So we'll hopefully get those back up and going summerish.
Maybe just a couple questions. Your thoughts on contact tracing and how businesses, large and small, might be able to help in that distribution of sampling. And is it something that the more people we have engaged in that, the faster we can get a sampling of the population?
Yeah, it's really an ongoing program. So UCSF, my group at UCSF is heavily involved in this and very directly involved in this, by the way. And so what contact tracing means is that, let's say you developed infection, you had a positive test, you got reported to the city health department, which needs to happen by law. We would call you up, or somebody from the city would call you up and say, okay, in the last 5 days, with whom have you been in contact? It's really 5 days ago and 1 and 2 days ago from your onset of your symptoms. At that point, you'd say, oh yeah, We would call those people and say, you've been in contact. You'd say, you've been in contact with somebody with diagnosed COVID. Do you know who it is? And they say, oh yeah, it's Rodney Fong, that guy. Yeah, we know who it is. and say, okay, so tell me about your exposure to Rodney, yada, yada, yada. And basically, if there are no masks, more than 10 minutes, close proximity, under 6 feet, we'd say, you need to get a test. Okay. We arrange the test. They go get the test. These are swabs. You get the test. If you're positive, you're infected. You have to go into isolation for a period of time, typically about 8 days. If you're negative and you truly are a close contact, you need to go into quarantine, which is a period of time of about 14 days from the time of it, from the point of exposure. So it's that's what contact tracing, and then it follows the people who are in quarantine and isolation. A lot of people, as you can imagine, aren't in a position to isolate at home. They don't have, they're living in a studio apartment. They have 3 roommates, whatever, right? Or they're homeless or marginally housed.
Mm-hmm.
The cities rented hotel rooms to put those people up during these periods of isolation, and to provide meals and the other things they need to survive. So that's what the program is. So it's not so much research as it is kind of a normal public health program, but we've just beefed up the manpower, the workforce from, say, 10 people who are doing it, and now we have about 140 doing it. And it's both our people from UCSF, that's about 40, a lot of people who have been from the civil service in San Francisco who haven't been able to work because their businesses, their places of work are closed. So we have people from the assessor's office, city attorney, the city libraries. So we have all the librarians doing this. And then we have our own medical students from UCSF, some nursing students from around the area, and retired nurses and doctors who also help us out with this. And then a bunch of other volunteers on top of that. So we've pushed the workforce up to about 140 people.
Would you say going forward as that expands that you would maybe ask or invite certain communities, maybe a large company or an office that represents a certain community to add to that sampling?
Yeah, maybe it's more that, I think we're going to need them in the other counties in the Bay Area.
Yeah.
Part of it is that these civil servants are going to have to go back to work at some point in time when we reopen the libraries or whatever. And that raises the question is, how do you replace them? Do you want to replace them with an all-volunteer workforce? Do you want to go out to San Francisco State and City College and hire people there who could start this as a career? San Francisco State has 600 students majoring in public health, which is a lot, right?
Yeah.
Or should we go to the public health school at Berkeley to find people? Or do we want to take people who've lost their jobs and who are, could do a perfectly reasonable job at it? Those are governor's office decisions. Right now, we're concentrating on retasking the civil service.
I'll take one of the questions from some of our listeners, and we've talked about this at the chamber, that the speed and efficiency in which the public schools come back into play is so important to the workforce that parents can get back. And you touched a little bit on it, but how do you think the public school system begins to work with DPH? They already do, obviously, but how do those two agencies quickly come to an agreement of what school size is going to be? Are there going to be evening classes and night classes and spreading out?
It's an incredibly complicated question. I think the commitment of the governor, I act like I'm reading his mind, but I've just listened to what he has to say, is to try and get schools up and going in July. So that's, it's not a perfect match, right? There going to have to be some architectural modification to keep students farther apart. I think there going to be a lot of experimentation with, staggered schedules, so that, as an example, that some students would go Monday, Wednesday, Friday, others would go Tuesday, Thursday, Saturday, something like that. And I think there's, or you could go mornings and afternoons like we did when we were in kindergarten.
Yep.
But the idea is that you cut down the size of you essentially limit the size of the schools, right? So if somebody gets sick, it only can spread through half of it or a third of it, or however you want to do it. So that's they're not going to be, I think it's unlikely that there'll be high school sports.
Mhm.
Certainly not this summer. Fall, who knows? We'll have to see. But again, there's this real concern about a second wave that would be driven by infection in kids in school. There's this is directly from influenza A as a model. Now, having said that, there's a tiny bit of literature about this and some experience that's accumulating in places like Iceland that would suggest that there's not really a lot, if any, infection among school children. Again, it's a pretty big bet to make, but it may be that we're spared the schools as a big incubator of disease, which is clearly the model for influenza A. It's clearly what happens with influenza A. If we don't have that, then we'll be lucky, and we can sort of gradually go back in and get the schools back up fully to speed.
Right. This is a very naive question. I apologize. But is the spike of the flu season in the fall and winter because of the actual temperature or the fact that it's colder out and we are going indoors for basketball season starts up?
Yeah.
We're spending more time in closer quarters to each other.
Yeah. Well, if that were true, it'd be in August in San Francisco, right? So, um, somebody gets that joke. No, it's because kids are in school. I mean, it's quite simple, right? And the reason it goes away in the summer is because the kids get out of school, right? I mean, that's the most simplistic way to explain it. Yes, there's some temperature stuff. Yes, there's some humidity stuff. Yes, there's a lot of indoor crowding for other people as well as kids, but it's largely kids that drive influenza A outbreaks.
Mm-hmm.
So you remember in 2009 when there was a swine flu outbreak that was first identified in Mexico and then came into the U.S. A lot of schools closed prematurely in the east and south. When they went back to school in the fall, so you have two side-by-side school districts in Texas. They go back to school in the fall. One goes back before the others. The one that goes back earlier, huge influenza A outbreak, spreads into the community, mayhem, right? The other doesn't, right? So that's clearly schools are a risk factor. But again, there's this sort of nagging thought in the back of people's heads that maybe it's not quite the same with COVID as it is with influenza A.
Yeah. Well, we have a lot of decisions to make in a crossroads
No
between
kidding.
health and economics and lifestyle and maybe even sanity. But I think that San Francisco, on the most part, has done a great job, and we just need to keep that up. It sounds like a lot of common sense is needed here from everybody's part.
Yeah, and I've worked a lot in public health over the years, and I have not come across a politician as willing to accept this kind of advice and as willing to act on this kind of advice as Mayor Breed. I think we also have to credit the other soups from the 5 counties and the Mayor of Berkeley. Berkeley has a separate health department for God knows what reason, but it does. So there were 2 mayors and 5 boards of supervisors involved in these decisions. And, we went out, we were the first ones to do it. We went way out in front on this. And I think you can see the results of what we did. Just to kind of tell the viewers one last little factoid, if you indulge me for another second. The original projections for death in the United States were between 1.7 and 2.2 million deaths in the absence of doing anything. So in the 6-county Bay Area, if you just do the multiplication, that's 34,000 to 44,000 deaths, tens of thousands of deaths. And we've had 272. And we're starting to tail off. So if we can maintain that, that's going to be a remarkable achievement. Each of the deaths is a tragedy. It leaves behind family. Somebody died early. It shouldn't have happened. But, it's not 34 or 44,000. Okay, so I think it's really quite a remarkable
It is.
feat of public health.
Well,
I'm glad that
you went out on it early and aggressively and gave advice. And we're lucky to have you. We're lucky to have Mayor Breed and Gavin Newsom, I think, to make these difficult decisions that are sometimes unpopular. but I think it's beginning to pay off. So want to thank you for your time. I know that UCSF has been a great partner of the chamber, but San Francisco, and if now, hopefully there are a lot of things that we all are enlightened by. Having a strong public health system, department, hospitals, reinvesting in that infrastructure is so important. So as hospitals want to grow, we should not get in their way, and I believe. As industries want to evolve in San Francisco, and we are the hotbed of many industries, including the medical industry, that we should not get in the way of that, and it could save many lives and get us back sooner. So want to thank you, CSF. Want to thank you personally. Hope to someday just sit down and have a pizza with you and talk about this stuff not under these crisis moments, but keep doing what you're doing. We are very proud of our own local hospital and proud of you. And thank you very much for doing with us. Maybe we'll check back in another month or so if we have to. And if things begin to change, you can give us a little more advice what the next phase looks like. That'd be great.
You bet. It's going to be evolving rapidly here over the next few days, so keep your eyes peeled.
Okay, we'll stay in touch. Thank you very much. And for those of you, thank you. For those of you who tuned in, thank you very much. We like to keep these Zooms short, so there's no Zoom overexposure. The Chamber of Commerce, we are celebrating our 170th year as a nonprofit in San Francisco, and this is much like a KQED speech. We need your support. Things are rough for all businesses and nonprofits, and if you can support the Chamber in any way, follow us on Facebook, social media, join us, support us, send us some cookies. We'd love to hear from you. So thanks very much, and we'll see you again. Thanks again, Dr. Rutherford.
You bet. Thank you.